Which brings me now to our safer at home restrictions. These restrictions went into effect on November 20th. At that time, Philadelphia's case rates were rising rapidly. Since then, the case rates have fallen 33%. And our hospital census, the number of patients with COVID in the hospitals, has fallen by 1/3 from the peak. Now, I'm hopeful that the current increase that we're seeing in cases around the state and to a small extent in the city will subside in the next week. With that in mind, we will back off cautiously on the restrictions effective this Saturday, January 16th. We will allow restaurants to provide indoor dining, effective that date, with seating of 25% of their approved occupancy for seated dining, plus other restrictions, such as a maximum table size of 4 and household members only, because we don't want people mixing with other households in restaurants and passing the infection that way. And that everyone must wear masks at all times, except for when they're seated at tables and eating. So they must wear a mask, for example, when they get up to go to the restroom. And the servers must wear both masks and face shields. Now, just to note that this 25 occupancy for seated dining is not 25% of maximum occupancy of a space. The legal occupancy of a space may be much larger than how many people can be seated at a restaurant. So this 25% is not comparable to the occupancy limits we have in other spaces. Now, with this, with all of our restaurants, we're encouraging them to improve their ventilation to reduce airborne spread of the virus. The 3 things in particular we're looking for restaurants to try to maximize. First, to maximize the percent of outdoor air that is circulated by their heating, ventilation, and air conditioning system, their HVAC system. The more outdoor air there is, the less any viral particles that are in the air are recirculated. Then we'd like to have restaurants have a filter in their system that has an MERV or MERV rating, 13 or greater. And then we'd like to have the system circulate enough so that there are 6 air exchanges per hour or more. To put it another way, that the air changes over in the indoor side of the restaurant every 10 minutes on average. Now that's what we're asking restaurants, not requiring, but asking restaurants to do across the city. But we're also currently working on enhanced standards that would be required for restaurants to have an increased percent occupancy. Now, we're not ready to announce that yet, but we hope we will announce that soon as we're ready. Now, we're also, with this changes in our restrictions, we're going to allow theaters to reopen the maximum occupancy of 10% and a requirement that everyone wear masks and that no one be served food or drinks. Because if you're consuming food and drinks, then you can't wear a mask. So to put this another way, if you're a restaurant, you cannot have entertainment. If you're a theater, you cannot have food, or you can have a theater that's not serving food, but you can't do both. And we're also allowing colleges to reopen for in-person instruction with occupancy restrictions and masks. Now, we will continue to prohibit indoor catered events and indoor social gatherings of any size. But these are social gatherings where people gather between households, and that's how the virus spreads from one household to another. This, we think, is the primary way that the virus is spreading right now, except for when it's within household members. So these are very important, so we're not allowing those to restart now. Now, there's detailed guidance for all of our sites on our website, www.phila.gov/COVID. And with these changes, I just need to remind people, as always, it is possible that we'll reinstitute these restrictions if the case rates rise and if we have reason to believe that the virus is spreading at these sites.